Hey, good evening. I'm Dr. Reiner, your host of the Independent Doctors of Pahrump, and tonight I have a special guest with us, Kelly Adams, the CEO of Desert View Hospital, and I like to have Kelly on every once in a while to update us what's going on with the hospital in the community. As a provider who's been here since the time when there was no hospital here, and there was the health center, which is now basically a healthcare partners facility, and having staffed that, I always have to go back to those days when the urgent care was the only facility in town, and we provided that care for almost the same number of people, maybe a little bit more, and how brutal it was to have to do that without the assistance of a hospital, and how nice it has been to have a hospital. And, you know, having sat through the administrators that have been through the hospital, I do believe, Kelly, and I say that, my opinion is that you've done a very good job since you've come to the hospital about bringing in specialist surgeons and upgrading the services of the hospital and becoming more functional for the community. And as you always known, millions of dollars go over the hill every year to Vegas, and it's good to be able to keep some of those services here. And I know that you know, we talk about that all the time, and in the interest of what he has done for, you know, the community is they've upgraded their CT scanner to one of the newest models. Is that correct?
Oh yeah, yeah. We have the the new
64 slice.
Yeah. No, 128.
128. Well, there you go.
So we're
I'm behind the scenes already.
We're as current as you can get with those types of pieces of equipment.
And with the 128 scanner, you're actually able to do one of the things that I know that you couldn't do was a CT angiogram with runoffs.
Right.
And you parlayed that with the vascular surgeon. So, which is he there? I mean,
Dr. Bernstein is there. You know, he comes in from Las Vegas. There's several patients that are referred to him, and he absolutely, he loves that piece of equipment, as well as Dr. Siegel and all the cardiology that are there. You know, the detail, and I don't know that you've been over yet to see the detail of that, Dr. Reiner, but the detail is 3D. It is globalized, so it can be moved all around. Wow. You're right, you look at any stenosis, be it in the heart or in the legs or arms, it's a phenomenal piece of equipment. It's as good as you can get here or UCLA. It is phenomenal.
Yeah. So see, those are the things that you're upgrading and bringing in and doing those as we do that. Plus your MRI has been upgraded.
That was brand new last year. Brand new 1.5 Tesla. Again, we just feel, I guess this is real wood. We can knock.
Yeah, you can knock on the wood.
We've been very fortunate to kind of have the community hospital really grow. Get the right kind of nursing training. We get the right type of equipment. We've gone from an era of, I call it just kind of community-based, to a larger regional referral. Albeit we're still 25 beds, and at some point we're going to be announcing an expansion. Not yet, but at some point we'll be doing that. Maybe we can come on one of your shows when we're ready to do that. And talk about those things. But not only those two pieces of equipment, the brand new digital mammography piece of equipment this past year as well. So all the pieces of equipment that has been there since the hospital began, we're updating and changing, and it is as current as it can be today.
Yeah, and that's important, and it's important for the community to know that, and I think with mammograms, for me, it's important to be able, and patients, if you don't really understand this, is when you get a mammogram done, and we'll digress for just a second, as with any test, it's so important to be able to go to the facility again and again and again, because these are one of the things that the radiologists always want to compare against the previous study. So the latest and greatest equipment will provide the deeper detail you need to be able to move forward and to hopefully detect a disease process years before it becomes a problem for you. So these are the things that that are very important to be able to remember, especially with mammograms, getting compared from year to year at the same facility. If you just get one mammogram done every 5 years, a lot of time lapses. If you got it done in California and you go to Vegas and you go to here, you lose continuity because that radiologist doesn't know about the other service or doesn't know about the other study that you had done. So with mammograms, comparison is the quintessential to be able to get the best reliable data and the best reliable results to prevent breast cancer.
Right.
So.
You know, next month is Breast Cancer Awareness Month, and so
Excellent.
the hospitals is offering, I think it's some additional data and information if they come in during the month of October.
Yeah.
There's some additional type of information, and I won't call it discounts, but there's some special programs they have during the month of October to encourage those to come in.
Okay. So if you're a MammoVan user, which has been out there for a while, I encourage you to ditch that and come get the latest and greatest stuff here in Pahrump, and that's very useful information. Also, I know you changed your ER group recently.
We did. As a matter of fact, it's a year ago this month that we traded out the group. And again, my type of administration, Dr. Reiner, as you know, is getting to the details and looking where the issues are, and even going back to your comment when you opened up the program of the number of out-migration, the patients going to Las Vegas for their care. And I've studied that, I've looked at it, and it's tens of millions of dollars that are going to Las Vegas as opposed to that could be staying right here in our own community. Now, we don't have all the services yet. We don't have all the cardiac pieces. We don't have all the pulmonary, all the plastic. There's a number of other things that we don't have. But there's enough footing now that we can really make a real impact on that. And so we want to go the direction of keeping the patients here. With the ER group, I believe we've increased the confidence of the community, the confidence of the EMTs, the confidence of the Sheriff's Department, and we have a wonderful working relationship with all of them, that our volume has increased by 42% this past year.
That's good.
Yeah, that's a confidence grower, and that's combined with something else I think you and I may want to talk about is, the Affordable Care Act has caused more people to come to your office, to the hospital and others, where the demands on health care are higher than they've been before. So not only are we providing quicker, competent types of service, we're getting more patients coming to the front door as well.
Yeah, no, and that's certainly true. And there isn't a healthcare provider out there that isn't experiencing the large growth in numbers of patients. And like a patient said to me today, well, how long does it take to get to see you? And I said, well, it could be 6 weeks to 2 months. And I like that, but it's bad for the patients. And so unfortunately, the Affordable Care Act, I thought, was supposed to try and make it affordable for people, but really it put a lot of people in the system that needed health care. And the bone of contention has always been those people use the most expensive point of service to get their health care, which is the ER and things of that. So did it really change the bottom line dollars? Because there's not been an accordant growth in healthcare providers to accommodate the number of patients that have come onto the system. And that has been, I think, the downfall of that. Plus, as I've said on the show before, it raised the bar so high. I mean, if you're a doctor or a nurse practitioner or even an RN, they're offering huge amounts of money for you to go work in these places. And someone told me that. And how can it's not the Affordable Care Act.
Evidenced by your very statement there in Las Vegas, 2 organizations have just opened up, one 150-bed addition, and another a 200-bed addition to their hospitals. And with that 350 additional beds, they have drawn staff from all around Las Vegas, and typically those nurses that would come out here because positions are full in Las Vegas, that we've enjoyed their employment.
But now
we're not doing too well in terms of staffing, so we have to bring in more expensive staffing, travelers and things like that from out of state. Again, those are the types of things that are compounding the expense of health care.
Yeah.
It's nice to have more facilities, but at the same time, competition, this is a unique thing we've not talked about before, but competition in healthcare isn't like competition at a gas station or cell phone business or whatever.
No, it's not.
It adds to the expense. It doesn't
does.
take away from the expense.
It does.
If you have to have an MR, I have to have a better MR.
Right.
You know, if you have a CT, I need a better CT. It's just the reversal of competition, what you think in the open market today.
Yeah, and reimbursement doesn't increase.
Reimbursement, in fact, is going down. You're probably seeing, I know you're seeing less reimbursement.
Yes.
The hospital's seeing less reimbursement.
Yeah.
And so we just have to go on the treadmill faster, to use that phrase.
That's right.
And so although we take care of patients, you see patients every day, man, it's very difficult to have a profitable business. We can't be in business and lose money. You're out of business. So if the hospital can be at the break even or just slightly above, we're very happy.
Right.
There.
And patients have to realize that it is a business, and you do have to have revenue streams to be able to afford that. And until the day comes when we all decide that, well, if I die, I die, but that doesn't happen. I mean, people want. They expect, and this has been an expectation for healthcare in America for years, and it's not gone away. It's gotten more in depth and more ingrained.
What you're talking about, if I can kind of paint a big picture here, is that all right?
Yeah, I mean, we're going to be going to break in about, we are going to go to break here in a minute. And there is a call-in number that'll come back in 727-8750. We'll be right back. Thank you for tuning in. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.